Does your loved one have vascular ulcers, particularly relating to the arterial system? I'm going to help you with this. I'm Alan Bienstock, and I am a board-certified plastic and reconstructive surgeon. I specialize in wound care, particularly those that are homebound and or bedbound. Today we're going to talk about different types of vascular ulcers. We've already addressed venous ulcers, which involves blood flow return. We talked about lymphedema. Today we're going to talk about arterial ulcers. What are those? Those are wounds that happen due to the fact that there's not adequate blood flow down to the lower extremity, which means you don't have enough blood flow, meaning bringing nutrients, oxygen, other necessary elements to help your foot or lower extremity to thrive. Why does this happen? Sometimes there's an occlusion in a vessel. Sometimes it's from smoking. There's different reasons. So the most important thing is what it's causing. How do you figure out if a patient has arterial disease? Unfortunately, in my practice, I have a lot of wounds that are a combination of both arterial and venous pathology, meaning that there's a compromise of both the blood flow to the foot as well as back to the foot. But today we're just really going to focus on arterial ulcers, meaning the blood flow down to the foot is impaired, which can involve either the foot, the ankle, or the shin. So what do you do in these cases? The most important thing is you have to make the diagnosis. So this involves either getting ABIs or arterial Dopplers. Once that is shown to be significant for poor blood flow, then I recommend the patient go into a vascular surgeon. This is not something that I can manage in the house. A vascular surgeon can look into non-invasive as well as invasive strategies. Sometimes there are different medications that can help with blood flow, such as pentoxiflin. Other options are putting a stent in one of the vessels if it's a particular vessel that's occluded. Other more invasive options are doing some sort of bypass. Once we've established that and that's been addressed, then we have to focus on the wound itself. These wounds are different than other wounds because we try not to do any surgical debridement. Surgical debridement is known to make the wounds worse if they're not infected. We want to make sure that we minimize the bacterial load. If there's any necrotic tissue, meaning there's dead tissue, we use an ointment called Santal, which is called collagenase. It means it helps breaks up the tissue. We want to keep the wound clean. We want to mitigate any bacterial colonization or infection. We use cleaning agents such as Dakins, acetic acid, or Vosh, which is hypochlorous acid. And in terms of the actual dressings, we want to make sure we're minimizing the drainage. We use different dressings such as Hydrofer Blue or Aquacel. We can't use enormous amount of compression. We had talked about compression in our session on venous stasis ulcers as well as lymphedema. If we do enormous amount of compression, it can further impair the blood flow down to that extremity. There are other options to help improve the wound healing, such as what's called topical oxygen therapy or hyperbaric oxygen. What this means is we're increasing the oxygen concentration in those wounds. The topical oxygen can be done at home. The hyperbaric oxygen has to be done in either a wound care center or an institution such as a hospital. These are very strong tools that I've used. In my practice, I've used topical oxygen therapy, which is basically putting a bag on lower extremity and delivering high-dose oxygen 3 to 4 times a week for an hour and a half. This has really improved a lot of my wounds that I've treated, particularly on the heel and the foot that suffer from arterial disease. We'll go into more detail in other sessions about arterial ulcers and in combination with venous stasis ulcers. If you have any questions regarding today's session, please leave them below. And also subscribe to the channel when you get a chance. I look forward to our next session and tutorial. Thank you so much.